And let's do this. Hi, everyone. I'm Shirley Weir. I'm the founder of Menopause Chicks, and it is my pleasure to welcome you to Love the Skin You're In. I was just saying, if you just joined, and I'm letting Sheila in now, if you just joined, today's event has been months in the making. It started with a conversation that I had the opportunity to have with the team at Vichy Canada about the number of questions we get in the Menopause Chicks community about skin health. And so we are so lucky today to be able to sit down with Dr. Jennifer Beecker, who is one of Canada's top dermatologists. And I don't know about you, but like, how often do we actually get to sit down for half an hour or an hour with a dermatologist? It's not that easy. So I think we are very, very blessed to have her time and her expertise with us today. So quick hi, Dr. Jennifer. Nice to meet you. We've talked a couple of times on the phone. Thank you for coming today.
Thanks so much for having me, Shirley. I'm really excited to be here as well. And I apologize as well to the participants. It took a few minutes to get there, but we're super excited to be here and I'm happy to take your questions. And here we go.
No apologies. So just a couple of housekeeping things. If you've just joined us, please find the chat bubble. That's where you can ask your questions. I will be moderating the questions towards the end. Dr. Beecker does have a bit of expertise to share with us, and then we're just going to open it to Q&A as always. As you may know, September is Menopause Awareness Month, and with the support of Vichy Canada, we feel very fortunate to be able to host this learning opportunity online. We also have a number of things to tell you, and I will post it into the chat as well. Vichy wants everyone to get a sample of the Neoviadol Night Cream. Sorry, I'm just kind of catching my breath after the technology, so bear with me. And we're going to post the link so that you can get your free sample for that, as well as 20% off today. You don't even need a code, so we're going to post that link towards the end of our discussion. And there is also a 3-piece anti-aging gift, which could include the new neck cream. So I'm very excited about that. I was on there this morning actually doing a bit of shopping. As I mentioned, we do get a lot of questions around skin health. So how this is going to work is Dr. Beecker is going to share with us some of her expertise and answer our questions, and then we are going to turn it over to you. So Dr. Beecker, maybe do you need a second to share your screen? We can get up there and get started.
I'll share it right now and let me know when you can see my screen.
We can see you right now. There you go.
Okay. Let me try this again. Wow, we've had lots of technical oh. Well, Shirley, if my presentation doesn't share this time, you share it from your end, maybe?
Yeah.
I know, it's so funny. It just worked, of course, right? We just did this. Yeah, it says that you've disabled screen sharing, so I couldn't do it, but.
You know what? I think I have to make you co-host again.
Okay.
So sorry. There we go.
I'll try again.
You will have the opportunity now.
Okay, I think this should work this time. It looks like it's working well. Can you see it now?
Yeah, so while you're doing that, I want to share a story with everyone. You know how sometimes our guests will have very formal introductions, and we could go through your long list of accolades and awards. But I want to share with you, Dr. Beecker, when we announced this event, I got this amazing text message from one of the members in our group. And she wanted me to know that her husband is one of your patients and how well you have taken care of him. And she just went on and on describing what an amazing healthcare provider you are. So I was like, Well, yeah, we are so blessed to have you today. So thank you for the time. I know you have a very busy schedule. Thank you for the time and thank you for the effort that you've put into this presentation. Let's get this started.
You're making me blush, Shirley. Thank you. That was really sweet of you to share. And thank you to whoever sent in that text. That's really nice. It's always, as a physician, that's always the biggest compliment you get is a thank you from a patient. So I really appreciate that. The title of this presentation is Love the Skin You're In. And I always say to people, you know, you're not 20 anymore, but who wants to be 20 anymore? So let's just go with it and love what we're doing. So I wanted to talk a little bit about common questions I get every day from women
Um,
about changes.
Excuse me, Dr. Beecker, I am so sorry to interrupt you. We are just receiving messages from a lot of people that are saying they would like to connect, but they still can't figure out how to connect.
Okay.
So I'm really sorry to start because like just to maybe help them to connect. So surely, if it's possible to just tell them how to connect, people on the Facebook that were waiting for the Facebook Live, how to connect to Zoom.
I'm getting a few people popping up as we go, and I'm admitting them.
Thank you.
That's amazing, and we are
Do
receiving
that
like
while I
there's
let others in.
we are receiving messages as well for people like some if we can provide them some help on how to connect. They joined the group, they just want to know how to connect.
Great. Do you want to wait a minute, or do you want to just, Shirley, do you want to just send them a message and then I'll keep going and we can answer questions at the end too? I can just continue and then we can answer some questions maybe at the end. I can always go through a few more things.
That would be perfect. Yeah.
Yeah, well, I'll get started then and we'll just keep letting people in as we go. So what I wanted to share was just some basic knowledge, some common questions I get from women. And again, if you have questions at the end, we can always go back and go over some of this. The most common question by far is about dry skin. It's no secret that as we all get older, and especially around the menopausal time, our skin gets drier. I'll go into some reasons for this, but that's definitely something that affects at least 40% of women with menopause, but I think that number is even higher. I get a lot of questions about sagging of the skin, loss of firmness and tone, how to improve the crepiness, especially under the eye area. So we'll talk about that a little bit. And then also questions about more sensitive skin. People who said, you know, my skin never had problems before, but now I'm having more sensitive skin, it's irritated. The products I've used for 20 years aren't working for me anymore, which they use. And they're having more rashes, you know, more breakouts and even acne, rosacea, that kind of thing. So we'll talk a little bit first about the dry skin. So, Doctor, why is my skin so dry? Well, one of the main reasons is decreased production of oil in your skin. At menopause, all of the hormones drop, and that includes some of the male hormones as well. There can be a little bit of more imbalance, a little more drop of estrogen and progesterone, but there has been shown, and Vichy's done some research on this, that the DHEAS, which is a male hormone, drops as well. Regardless, we get a decreased production of oil in the skin, and the oil and the fatty acids are one of the things that keep moisture in. pH changes contribute to dry skin as well, and one of the big ones is the loss of hyaluronic acid. So when we lose hyaluronic acid, we lose all the moisture grabbing qualities of our skin. Hyaluronic acid I describe as a molecular sponge or like a magnet for water. It holds over 1,000 times its weight in water, so it draws water in from the environment and holds it. So when we're younger, we have lots of hyaluronic acid in our skin, which gives that plumpness and that sort of supple, radiant look to our skin. But over time, we lose 1% of our hyaluronic acid stores per year, so 10% per decade, and around menopause, that goes a little bit further. We produce less hyaluronic acid as well. So we get that creepy texture, some of those visible fine lines. So that's the reasoning behind why skin can get very dry around the menopause and perimenopause period. So what can we do about it? Well, the main thing is gentle cleansing to begin with. You don't want to strip away the oils that are naturally there and protecting your skin and still keeping the moisture in. So washing with a gentle fragrance-free cleanser as opposed to a soap. You don't want to use the soap in the shower. You want to have a cleanser. If that's still too harsh on your skin or you're finding it difficult to remove your makeup, micellar water is a really nice option as well. And some patients even plain water, and that's especially for the body. Most women I find are wearing some sunscreen or a little bit of makeup, and they do want to use a cleanser. However, on the body, remember, if your skin is dry on your body, you don't really need soap all over your arms and your legs if they're not dirty. You can use soap more armpits, groin, and feet. And then just plain water, let it wash over in the shower. That's enough to keep the cleansing gentle, so you're not stripping your skin of its oils. And then moisturizing at least twice daily. And for some people, it's more. Moisturize every time your skin does feel dry. There's many patients I have who have to moisturize 3 times a day. Believe it or not, that's not uncommon. So you want to try and do it at least twice a day. Immediately after washing the skin, the same idea of kind of sealing that moisture in as the skin is damp, pat dry, and then you immediately want to do your skincare regime on damp skin. Before your moisturizer, if your skin is very dry, I would consider a serum or a booster with hyaluronic acid before you moisturize to try and give that hyaluronic acid boost, plump up and smooth your skin before putting on a moisturizer with an emollient and a humectant. So what are those things? Hyaluronic acid is a humectant. So humectants, again, are drawing in water from their environment and plumping up the skin. And a lot of the emollients and moisturizers are kind of sealing over your skin to hold in the water. So both those things, and many good moisturizers will have this, but you want to have something gentle and simple. And the next question is, people say, well, is that it? Is that all I should be doing? Should I be doing, one of the 7-step regimes? Should I be doing this? Well, the number one thing I would say, if you're worried about aging, would be sun protection. And then the second thing is sun protection. And the third thing is sun protection. I can't overemphasize this as much enough, just because sun protection is responsible for a lot of our aging. And when you look at this picture, I always love this picture because this woman worked beside a window. The left side of her face was towards a window for 28 years. And just the UVA rays coming through the window has photo aged her left side of her face so much more than the right. So on her right, she still has signs of aging, but it's nowhere near the left side. So sun protection is still critical. Many of those things we can control. So there's some things in life we can control and some things we can't control, but this is something we can definitely control. And so sun protection in the morning every single day, even in the winter, is really, really important. I'm just admitting somebody.
I did too. It's okay.
Okay. Just in case you're wondering why I'm pausing, I'm letting some people out. And then dullness. I mean, dullness and dryness go together. I do find that hyaluronic acid serums or hyaluronic acid in your moisturizer helps a lot to help with dull appearing skin. But you can also consider adding in a glycolic acid or a retinol or retinoic acid into your regime if you're finding you're having trouble with that dull look. And if your skin is not too sensitive, again, these are still acids. They're very mild, but if you have very irritated skin, I wouldn't suggest going to this right away. But your skin, if it's not overly sensitive and you want to kind of get a more radiant look, these products will help with exfoliation and cell turnover and cell renewal. So they would be something you could add. And then why is your skin sagging? Well, it's frustrating, but we have very rapid collagen loss at menopause, the first 5 years after menopause, and then 2% per year in the next 10 years. Again, practicing good skincare, but also the sun protection will help further collagen loss as the sun does thin the skin as well. So we want to control the things that we can. And lastly, a lot of new rashes, acne, rosacea can come around menopause. And what I tell patients is please keep it simple in terms of your skincare regime. You still need to moisturize your skin if you have acne. Acne at menopause is very different than teenage acne, as many people probably know, in rosacea. The products that are geared towards teens are geared more towards skin with higher oil and sebum, not perimenopausal, menopausal, or postmenopausal skin. So what I would suggest is keep your skincare regime very simple. Don't add a lot in. If you have a lot of blocked pores or blackheads, you could add a product with salicylic acid in it as a wash. But beyond that, I would suggest you see a board certified or Royal College certified dermatologist, because many times we have to address the hormonal aspects behind these rashes, and that's why it's important to come see somebody who can help you with that more on the medical side. So I'll keep it at that for now to have lots of time for questions, Shirley. I hope that kind of goes over some of the basics, so it will give us a platform for people to think about further questions. And there we go.
That's great, thanks. Do you want to stop sharing your screen and we can see a bigger?
Sure.
Amazing. Yeah. And you know, as you were speaking there, I'm thinking about my two children who've been challenged with acne. I know my mother was challenged with redness and rosacea for years. And it's about skin health and it's about confidence, which is a word that we use a lot when we're talking about the mission of Menopause Chicks. So I think that's why it's so important that so many of you have showed up today. And if you have questions, please pop them into the chat. We have a few already, so let's get started. Karen has a question regarding dry skin, and she wants to know if taking oral hyaluronic acid would help.
Hasn't been proven to work yet. You know, it's interesting because the acids in your stomach, you know, pH of your stomach is about 2, and so it's very hard to get a lot of proteins to get to the point where you actually absorb them. They're broken down so much first. So typically, topical seems to work well, but we don't have really solid data for anything oral, unfortunately.
Okay. And if you haven't noticed it in the chat already, I have posted the link where you can pop on to Vichy.ca and get your free sample, as well as do some online shopping there. Today, you don't even need a code to get 20% off. Dr. Beecker, Justine has a question about wanting to know if hormone therapy could support or reverse the signs of aging.
Yeah, it's a great question, and it's a tough one to answer because the literature is very mixed, actually. So there are some studies that show that patients who are on hormone replacement therapy do have more elasticity in their skin. They tend to have more collagen. In general, all of the measures when they actually take a skin biopsy are better. But there's other studies where when they've asked the patients whether they notice any improvement in their skin, they really haven't appreciated a significant improvement. So it's interesting because, you know, if you look clinically, there are changes molecularly, and it's a bit controversial. Some of the studies have shown that if you smoke, it kind of reverses those changes and improvements we see with hormone replacement therapy. So in some studies, they found that smokers did not get the benefits that non-smokers. So overall, I would say that the feeling in the dermatology community is that hormone replacement therapy does help with the skin changes. It's better, like many things, to start earlier than later. It doesn't tend to reverse as many changes as it would prevent, you know, collagen loss. People are still looking at it. The studies are ongoing. I think in 10 years, we'll have a very definitive answer on that. But overall, most studies favor that it does help your skin.
And so does not smoking, and so does sunscreen protection.
Yes, exactly. So it's hard sometimes to weed out, you know, the way the studies were done. Some of them are survey based and some of them are, you know, historical. So sometimes that's not the highest quality data. That's why I waffle a little bit on that answer, because I think we really need good, hard prospective data. That means where you follow women forward and then see in 20 years, is there really a difference on all comers? It's hard when you look backwards. So that's why the data is, you know, it's a little bit waffly.
Yeah, definitely, definitely. Sharon has a common question, and that is about the increase of skin tags. First of all, what are skin tags, and do they increase in midlife?
They increase with time. It's interesting. They're not necessarily related to hormonal changes, but they're more related to time and friction. So what happens is areas like around the neck or in folds around the groin or the armpits where there's friction, you can develop these little, what we call in dermatology, pedunculated tags, or little pieces of skin that stick out. They're pretty easy to treat if you see a dermatologist, by the way. So if you go away, but definitely we do see more with more friction and with increased weight. Sometimes that makes a difference. So just something to think about. Of course, it's very easy to say lose weight. That's not an easy thing to do. So sometimes it's easier just to get them treated. And it's pretty easy. Usually we just do a little bit of a kind of a hot needle approach where you dry them and they just fall off.
And what if you don't treat them?
There's nothing worrisome about them. They don't turn into cancer. There's nothing to worry about at all.
Excellent point. Thank you so much. Okay, this is a very common question as well, and it's about itchiness. And I know we hear from a number of members too who have extreme itchiness. So hives, welts, waking up in the middle of the night and not being able to stop scratching their forearms. This is a common question.
Yeah, so I think that itchiness is multifactorial. So everybody may be a little bit different, but there's some common things you can do to help with itch in general. The first would be, we talked about earlier, dealing with dry skin concerns. So always not overwashing, like we talked about, staying away from soaps, but using more gentle cleansers, only using those cleansers on armpits, groin, and feet. Just let water run over the rest of your body because a lot of it is dryness related. Always putting on a moisturizer immediately after bathing while your skin's still damp, and then one other time in the day, at least twice a day, usually right before bed because most people get itchy at night. Keep your room cool, so definitely a couple of degrees cooler than you would like. Sometimes in the winter, if it is more dry skin related, a humidifier in the room helps. If you are going crazy with itch and you need a rescue treatment, I always recommend an ice pack. Have something handy. Ice pack on an itchy area is always a really quick way. I have patients with skin conditions with severe itch, and usually they fall asleep even with an ice pack on at times. Make sure your medications aren't causing itch. So a good review of your medications from your physician or by a dermatologist would be recommended, because many medications in the right patient can cause itchiness as well, especially if there's things like hives or welts coming up. I think it's really important to make sure there's not something medication induced. And if those basic things aren't working, you really do need to see a dermatologist, because there's so many causes in it. And then we're talking more about medical therapy and ways to kind of make your quality of life better. Because itch is a very severe symptom. It can affect people's quality of life severely. I'm sure people on this call will know. And so it's important to have it treated properly if you're not getting relief with those basic measures that we can do.
Excellent. Karen has a question, and it's about skin, but I believe it's also about navigating our health system. So here in Canada, in order to see a dermatologist, we would need a referral from our GP or family physician, correct?
Yes.
Yeah, so Karen's scenario is, as she had a hysterectomy, she is currently dealing with dry, scaly patches on her chin and her face. And the gynecologist told her that she should see a dermatologist because it's allergy related. And her dermatologist told her she should see her gynecologist because it's hormone related. And so she's feeling really frustrated today.
Oh boy. Oh boy. I'm sorry to hear that. These things happen sometimes when you go from specialist to specialist. So I think in that situation, I think it's good if both specialists talk together. So there's a couple ways to ask for that to happen. Right now, we're in a unique position where, people are doing a lot of virtual appointments. So I think it could be a time where you could see if there's an opportunity to have a virtual appointment or a phone appointment with both specialists together. That sometimes is hard to navigate with two specialists schedule, or just have a phone appointment, even another phone appointment with a gynecologist, asking if they could have a conversation together and just explain the situation. And I think most people would understand that, because I've had patients with similar situations where, like, well, they sent me to you, and then we'll say, you know what, we need to talk then, so that we're both on the same page. And so I think the key is just to ask about it in a way that's accommodating, so maybe give them a few options and say, maybe could you guys talk together, or could we do a three-way appointment on the phone, or what would work for you, so that we can kind of figure this out. And I hope that helps.
I think that helps me. And I think it helps remind all of us that it's okay to ask. Like, the worst thing that can happen is the answer is no, but at least you have asked. And often as we're navigating or being our own best health advocates, we forget that we have that right to ask. So thank you for those script tips too. Okay, Sheila has a question about facial brown spots, and she's in postmenopause. She does want to know if estradiol is contributing to the problem.
Yeah, it's could be. Let's put it that way. So brown spots, I always tell my patients, there's about 3,000 diseases or skin diseases in dermatology, and half of them are red and the other half are brown. So there's a lot of causes of brown spots. So we want to be careful about assuming what's happening. And also depending on skin type, if you're a light skin tone versus a dark skin tone, there's different types of brown spots that can be happening. What she may be referring to is more like melasma pigmentation, or it could be sun damage. Melasma is still sun related. So the first thing I would suggest would be make sure you're having good sun protection every day. And then I would speak to your doctor about the estradiol. You could do a referral to a dermatologist over this just to discuss the timing. Sometimes hormones can be implicated in melasma and pigmentation, but I would just worry that it's not the correct diagnosis. And the reason to see the dermatologist is say, okay, what is the brown spot? Is it just a regular age-related brown spot? Is it a sunspot? Or is it a melasma type pigmentation that could be related to the hormones? So I would never want to counsel you to stop your hormones without knowing what the cause of the brown spots are, because it might be completely unrelated or it could be related. So I would seek the expertise if you can.
Okay, thank you. Hopefully that was helpful, Sheila. Tara also had a question about melasma, wanted to know if it's hormone related and if hormone balancing could help.
So it's a great question. Melasma is multifactorial. By far the biggest factor with melasma is sun, UV, and not just UV, but we also think visible light, believe it or not, plays a big role in melasma. Hormones do play a role in melasma because we do know that women who are pregnant, who are on oral contraceptives, tend to develop melasma more. But interestingly, men can get melasma too. So there's more to it. There's several factors, but I would focus more on the sun protection aspect. We haven't seen a lot of improvement with melasma with hormonal therapies. Unfortunately, it's been very disappointing. There are other therapies though that do help melasma. They're more related to, believe it or not, there's a medication you can take that's more related to clotting in your blood. It's very interesting, but it's kind of a complex topic. But good sun protection every day that's blocks out not only UVA, but visible light if possible. So mineral type of makeups on top, or a mineral sunscreen with a mineral makeup after, really important for melasma. A hat, even just a little bit of sun. So I wouldn't assume that changing the hormones will make a difference. In fact, in women who were postmenopausal, who went into menopause and then didn't supplement with hormone replacement therapy, had ongoing melasma. So withdrawing the hormones doesn't always solve the problem.
Okay, thank you. Angela has an interesting situation. So her whole life she has had dry, sensitive skin. But a few weeks ago, she woke up and her face and hair were oily, and now she has dry, irritated patches mixed with a slick of oil and acne, she says. Help.
Okay. Well, I definitely think you'll need more medical therapy. I don't think this will be something where you can just fix with over the counter. Of course, I wouldn't change a lot of your over the counter. Like, it's not a time to change the products you're using at the moment, because sometimes by changing things can get worse. I think that's worth a consultation with a dermatologist to be sure that you don't need to have more. Again, it's not hormone replacement, but more a hormonally based therapy for the skin. It's a little bit different. Sometimes we're actually using medicines that block the male hormone at the time of menopause to treat some of these problems. I do think that's worth a consultation. So in the meantime, gentle skincare, if you're not using it already, try not to put any extra products on your skin if you can, because that can make things worse. Just stick to like the gentle, like I was saying earlier, hyaluronic acid based moisturizers, nothing too oily. Just try and keep everything really simple. And then that will hopefully, being kind to your skin in the next couple of weeks. If you're not better, you can talk to a dermatologist. It's actually not too bad right now with the virtual aspect, just for access to healthcare. People can get virtual appointments with dermatologists and phone appointments quite quickly right now because of the change in with COVID. So
yeah, there's been some silver linings for sure. For sure. Because you just mentioned it, I think it would be a good time to underscore something that I hear a lot is women will say things like, I haven't changed a thing. I
yeah.
continue to use the same products I've been using for 20 or 30 years, but what's happening? So can you maybe speak to what we should be considering in terms of sticking with a routine or changing our routine?
So it depends on whether you're getting a rash. That's kind of the deciding point. So
Okay.
you can definitely change a routine if it's just, okay, my skin is now drier. I can't get the moisture I used to. I mean, that's really common where we all wake up one day and we're like, that didn't look like that a few years ago. It's a little duller and everything just feels like you need something different. So in those situations where it's just a subtle change, that's common with perimenopause, menopause, postmenopause time. That's when you're adding in the hyaluronic acid boosters. That's when you're looking for a moisturizer that has more of those, anti-aging type products, which include the hyaluronic acid. It also includes, a thicker emollient sometimes, and then more gentle skincare, like we were saying, getting away from the soaps and the cleansing habits from before. And some people, it's just micellar water or plain water to cleanse. The time where it changes and you have to really reassess your products is if you start getting a rash. So rather than add on, sometimes people get a rash on their face and they think, oh, I've got a rash, I should try this and I should try this. And that's when I see problems. So you want to back off, not necessarily put something new on and then be assessed, because sometimes that could be an allergy to a preservative in a product or allergy to a fragrance in a product. It's more that there's something different that's happened. So rather than adding something into the equation, it's actually better to back off a little bit. So if you're using 4 or 5 products, maybe just back off, just plain water to wash and something really simple, fragrance-free for a moisturizer, and then leave it at that. That's the deciding point. So no rash, that's a different situation. We all have to change quickly. If there's a rash, you're almost wanting to back off.
Those are good tips. And it makes me think, I'm grateful that Vichy today is giving all of us the opportunity to request a sample, because sampling is really important if you're thinking about changing your routine before you go and buy the whole, spend hundreds of dollars and come home and not really be making an informed decision. You have this opportunity to get a sample. So don't be afraid to ask for that as well.
And
Yeah.
if I may, Shirley, hi, it's Noor
Yeah.
from Vichy. Hi, everyone. If I may just add that all of our Neovadiol range that you just spoke about, including the sample, is hypoallergenic, tested on sensitive skin, and it also contains hyaluronic acid as well, like for a good moisture.
That's great. And we have a couple of product questions, Noor, so I'm glad that you're with us. Yeah.
Definitely. Sure. I'm ready to answer any product question.
Yeah, Justine has a question about which products you would recommend that contain hyaluronic acid.
So, as I said, like all of our Neovadiol moisturizing creams contain hyaluronic acid. So the night one that you showed early on in the presentation contains that, and it also contains a technology that helps decrease the temperature of the skin. So it really helps with the hot flashes. And also the day creams from Neovadiol, they do contain hyaluronic acid. So I would recommend that. And if you're looking just for a product that only contains hyaluronic acid, I would recommend Mineral 89, which is a product that's basically made of hyaluronic acid and Vichy volcanic water. But otherwise, for Neovadiol, which is our range that's directed towards skin perimenopause and menopause related skin concerns, the entire range, day creams and night creams, contains hyaluronic acid, and it's hypoallergenic and tested on sensitive skin.
Awesome. We also have a product question, Dr. Beecker, about sunscreen. Any recommendations?
Right. I like, in general, sunscreens in Canada can be recognized by the Canadian Dermatology Association. So if you're as a blanket statement, I say, you know, look for that symbol on the product, because that will help guide you. It depends on your skin type and your skin color. There's tons out there that are wonderful in terms of whether you go mineral or more like a chemical based sunscreen will depend on how your skin feels. If you're more sensitive skinned, I do find that the mineral sunscreens are a little bit gentler, just anecdotally. So if you tend to have more a sensitive skin, maybe stick with more physical or mineral sunscreen. If you want to wear it as a moisturizer, there's lots that have tint in them. If you're not overly sensitive, the combination with mineral and chemical together do offer great protection. There's a lot of lightweight things. I like a lot of brands. I usually like people to stay fragrance free if possible. That's my preference as a dermatologist, and with the minimal preservatives. So there's several different brands. Given that this is a Vichy sponsored event, Vichy does have a lot of wonderful sunscreens. I personally love their sports sunscreen for exercising. It's very lightweight. They have a lot of lightweight products. It's a real try it on your skin and see how it feels. If you are of a darker skin tone, I would recommend going with the ones that say lotion or lightweight lotion or clear. You know, there's several that say clear on them. So it is a little trial and error. I'm with you, Shirley, saying you do have to try it. The sunscreen I would use will be different from the sunscreen that you would use. The main thing is the SPF is at least 30 for most women. I do recommend over 50, the 50 plus, because again, we're dealing with brown spots and aging as well. So for skin protection, we want a 30, but for anti-aging, we want a 50 every single day. And it's really the one that feels good on your skin and that you'll wear every day. So there's lots of great ones, fragrance free. Look for the Canadian Dermatology Association symbol.
Great.
And if I may add to what Dr. Beecker is saying, honestly, if there's one thing I learned choosing a sunscreen is to choose one that I am going to use. And I also, the Vichy Sports is my favorite. I just wanted to say that Vichy does offer a wide range of sunscreens that are fragrance-free and recognized by the Canadian Dermatology Association. So we do offer chemical sunscreen and physical sunscreen as well, and a tinted one. So and also suitable for sensitive skin as well.
And I will add that I do give a list of sunscreens often to my patients who have sensitive skin, and the Vichy products are on it. So I'm not just saying that because it's with Vichy. It's actually is a very good line for that reason. They have fragrance free, they're recognized. So it is one of the many. I never just recommend one. It's not the only one, but it is on that list.
Yeah, that's great. And Carol just asked a question about sensitivity to perfume. So I'm glad that you mentioned that as well, because she notices now that she's reacting by getting red and rashy.
Yeah, I mean, perfume or fragrance allergy is one of the top 10 skin allergies we see. When we talk about contact dermatitis in dermatology, it's a red, itchy rash. And that's why earlier when somebody was talking about having kind of this crazy rash that started the last few weeks, we always talk about backing off from the products you're on, because even though you've used a product for years, you can develop an allergy to fragrance or perfume anytime, or a preservative or something in that product. It can happen at any time. Allergy is something that develops in people. You're not necessarily born with it. So as soon as you notice any irritation, back off. If you're noticing that you are kind of suffering from rashes or irritation from fragrance or perfume, it's not something that tends to go away. So I would be very cautious, become a label reader, look for products that say fragrance free. That language usually means there's no fragrance. Sometimes products can say unscented and there's a masking scent in them. So I like the words fragrance free. Typically they don't have any of those perfumes in them. Be really careful. Shampoo is really hard too. So something for people to think about is that there's sometimes their face is still breaking out despite stopping a product. Think about your shampoo. It has, most of them have a lot of fragrance.
I love that. Be a label reader in everything, including skincare, especially skin health. I think we're getting near to the end. We just have a couple more questions. I hope you can stay with us for a few more minutes, Dr. Beecker.
Absolutely.
Justine, and forgive me if I'm not pronouncing this correctly, but Justine is a prescription for tretinoin.
Tretinoin, yes. Yeah,
Okay.
it's retinoic acid, yes.
And she wants to know if she can use it indefinitely.
Absolutely. In fact, it's kind of meant to be that way.
Okay.
If you're using it more for fine lines, for anti-aging properties, absolutely, it's a lifelong beauty regime. So as long as your skin is tolerating it, you know, sometimes again, skin changes and sometimes people get sensitive. But if you're using it every day, usually you tolerate retinoic acids and retinols quite well. So just continue it forever if you can.
Okay, thank you. Sharon has a question about skin bumps, and she believes it's related to sweating in her workout clothing. Do you have any suggestions?
It's probably acne mechanica. So a lot of times people get this on their buttocks under their workout clothes. I'm sure there's many people, you know, if they like to go spinning, they're sitting around. So a couple of things, if it's on the body, it's often related to sweating. She's totally correct. The key is, so if it's under clothing, take your workout clothes off right away, change immediately. If you can shower right away, shower immediately. So you want to get the sweat. It's just basically occlusion. It's a tricky problem to solve if you work out a lot, but I have a couple of tips. So clothes off as fast as you can, shower immediately. If that's not doing it and you're still getting a lot of acne bumps, then use a benzoyl peroxide wash in the shower, all over end of your shower. So again, sometimes it's chest and sometimes it's buttocks. It depends. A lot of women get it on the buttocks. So leave it on for about a minute, rinse off, you know, just let it rinse off gently, and use a white towel because benzoyl peroxide does bleach things.
Yes.
Now, I don't recommend benzoyl peroxide on the face in a perimenopausal or menopausal woman because it's too drying. But on the buttock area, after, if you're getting acne mechanica from working out, that usually helps.
Excellent. Here's one more that we haven't had yet today, and that is about the skin on our neck. So I can't see this person's name because it's on Zoom, but it's a question about sagging skin, especially in the neck. How do I improve and or reverse? Any suggestions?
Yeah, so it's neck is really a tricky place. So the same principles apply. So neck, if it's more on the sides especially, we get a lot of sun damage and thinning of that area. So don't forget when you're doing your daily sunscreen to apply to your neck. You usually don't need it so much under here, but at least over here, because you see a lot of pigment changes and people getting that red, blotchy, thin skin. That's all sun damage. In terms of getting things under here, again, hyaluronic acid based products help because they do help to plump the skin. You do get a lot of crepey skin on the neck. So I find that the boosters, you know, Noor mentioned the mineral 89. I like that one. They're very light and absorb very quickly, and putting that under your moisturizer is a great way to help the neck. If you're getting to the point where it's you know, very saggy, or genetically everybody in your family has that, what we call the turkey waddle, then you're getting to more advanced techniques and you need to talk to your cosmetic dermatologist about that.
Thank you. Well, I have one more question for you, but first I'm just going to repost the links for everyone in the chat so you can make sure that you hop online right now and request your sample and do some online shopping at Vichy today. You can save 20% and you don't even need a code for today. We will also include all this information with a copy of the replay so you can watch, rewatch, share it with your friends. And Dr. Beecker, I just really want to thank you on behalf of everyone at Menopause Chicks for sharing your expertise and answering so many of our questions today.
Yeah, it's my pleasure. I really hope that I was able to answer your questions in the way that is helpful. If there was anything that was missed, I'm always happy to follow up later. Sometimes it's difficult on Zoom because I can't see everybody's rash or their problem, and I'm a visual person being a dermatologist, so I'm trying to give some general advice to everybody. So I sincerely hope that it's helpful to you, and it's my pleasure being here today. Thank you for having me.
I have one more question, and that's a question that I ask all of our guest experts.
Uh-oh.
If there is one thing that you would like women navigating perimenopause to menopause and beyond to know, what is that one thing?
Oh boy, I have to think about it from a skin perspective, and I don't want to be too repetitive, but I would just say, just if you haven't started wearing sunscreen, wear your sunscreen every day, please. You'll be so glad later. I spend a lot of my days taking off skin cancers, so I think preventatively. So if there's something I want you to know now is start doing it now, so that, you know, when you're healthy and looking beautiful in your 80s, we won't have to see each other. Not that I won't want to see you, but hopefully be on better terms than the skin cancer.
Well, we had a bet that you were going to say sunscreen,
Yeah.
so I knew that. But you know, in all seriousness, one of the words that we use a lot at the Menopause Chicks community is the word invest, and that keeps coming up for me today as you're speaking. It's whatever we can do now to invest in our skin health for, you know, the immediate future and the long-term future.
Yeah, there's no better investment than sunscreen. You know, when you look at the data, you know, there's such a clear benefit for aging, for health. And even though, you know, there have been concerns in the media in the last few years, and some people have brought up some of these, the benefit risk ratio just far outweighs using sunscreen, and I highly recommend it. And I hope that helps convince people about it. I really would like to save a lot of people a lot of grief later on.
Amazing, amazing. Well, this is a full circle moment because I started out by introducing you and telling you about a member whose husband is one of your patients. We just had a participant jump into the chat and tell us that she is your patient and is sharing with everyone how wonderful you are and how lucky she is to have you on her health team.
Thank you. And thank you so much. And I'll close the same way and say, you know, there's no bigger compliment or means more than me than a thank you or a compliment from a patient, because that means I'm doing my job. I think, like all dermatologists, we all want to improve the lives of patients and improve their skin health. So if it's helpful, then that makes my day. Thank you.
Thank you. And sorry, Noor?
Excuse me, Shirley, would just like to take the opportunity to also thank Dr. Beecker for being here today and for really, you know, sharing her expertise and, you know, helping all of us to answer questions. And I want to thank you for hosting this event. And I want to thank you for all of your help and in preparing this and the question that that you helped raise to Dr. Beecker. I know you want to conclude. I would just like to just remind everyone that that today Vichy is offering a 20% off on all neovagial products. So there's no code. They can just go on the website on Vichy.ca, and there's a gift that will be offered, a 3-piece gift of a value of $40 for orders of $70 and above. And it does include our new neovagial neck cream, a sample of the new neck cream, since the last question was related to the neck area. So I thought I would share that. And again, thank you both for this event today.
Yeah, thank you, Noor, and to everyone at Vichy for sharing our mission for empowering women to put their own name at the top of their to-do list. We've shared the links a couple of times in the chat. We'll watch your email, and we'll also make sure that you get a copy of this recording as well as the links so you can go online and do your shopping today. Anyway, thank you so much, and I look forward to speaking with you again, Dr. Beecker. This was great.
Thank you, Shirley. Thank you, everybody. And thank you for being so patient with our technology issues at the beginning. We really want to be here for you. Thanks so much.
Amazing. Thanks, everyone.